If you've thrown out your low back, you know that it is a big deal, right? It's not like tweaking your shoulder or rolling your ankle. When you throw out your back, everything hurts. I mean, any kind of movement is going to involve your spine, and just being able to get up out of the chair, off the couch, walk around the office, being able to do everyday life activities or even go to work is a big challenge, okay? So when we first throw out our back or tweak our back, we want to introduce some very, very fine movement, get some of those muscles around the low back contracting, and try to get them to slowly relax and release. What that pain is feeling is you most likely had some kind of movement fault that put the spinal cord or central nervous system in some kind of vulnerable position, and then you're getting that reflexive guarding of that low back musculature where you feel super tight, and you kind of feel that pelvic tilt, just don't feel like you're in great alignment, okay? What we want to do is start to slowly apply a little bit of resistance to that muscle group and let it calm down and let our bodies know that I'm okay, I can start moving again. So try to give you guys something that you can work on just from home. All right, so I'm Dr. Brett Rollison with Ground Overhead Physical Therapy. We're giving you guys videos every single day. If you haven't done so, subscribe to the channel. We're posting videos to give you guys training ideas, rehab ideas, and ways to get out of pain fast. Okay, so for the low back, we've made other videos on using the lacrosse ball. It's a great idea to do some kind of soft tissue work. But next we're going to do a isometric push-pull exercise for the hips and low back. All right, so if you're at a home office or working in a cubicle and you got a little bit of privacy, this is something you can do easily. All you need is be able to get down onto the ground. Okay, so I'm going to come all the way down onto the ground, and I'm going to go into a tabletop or dead bug posture. Okay, from here, I'm going to have one hand on the front of my knee, the other hand cupped around my knee. Okay, and all I'm going to do is I'm going to use these to keep my hips or knees from moving in any direction. So with this leg, I'm trying to pull the leg up, and with this one, I'm trying to send the leg down. All I'm going to do is block those motions. All right, so I'm going to start to contract. This knee's trying to go this way, this one's trying to go that way, but I'm blocking them. And if 10 is as hard as I can possibly push or pull, I'm going to go about 3 or 4, okay? So I'm not going all out, just enough that you feel the muscles contracting. I'm going to hold here for about 30 seconds. And once I'm done with that, I'm just going to simply flip-flop my hands. So now this one goes around my knee, this one's in front, and I'm going to repeat on the opposite side again for 30 seconds, going about 3 or 4 out of 10 with my force. And what I'm going to do is I'm going to hit both sides anywhere from 2 to 3 times, okay, just enough so that I feel the muscles contracting, but shouldn't be painful. Okay guys, so what we're doing is we're just doing an isometric contraction, getting those muscles to contract and hopefully relax afterwards. But you can see we're not having any kind of crazy movement going on that puts the back in any kind of vulnerable position. So this is a really, really good one to try out right after you've initially hurt the back and you're kind of in that really vulnerable kind of fight or flight stage right after you hurt it. Okay, so give it a shot, guys, and tune back in tomorrow for another video on how to bulletproof your body and be your absolute best.